All right, we want to welcome you all in. It's been a very busy week here in the ABC 15 newsroom. Garrett and I are each here right now, obviously monitoring election results, but we also wanted to keep you updated on what's happening with the coronavirus, specifically what's happening in Arizona, so that you can make the best choices for your health and your life. You know your health better than anybody, but we want to help you be able to find the numbers so that you can make the very best choices. Whew, Garrett, everybody said this would be gone by election day, but it's still here, still going on.
Definitely still here.
Yeah, definitely still here. In fact, sad to report that we've had today almost 2,000 cases reported. Yesterday, we did go over that 2,000 mark. And in the comments, I want to remind all of you that you can leave us your questions and we can get those answered for you. Sorry about the mess behind me on the desk. I'm seeing wipes and water and everything else. We're living in here right now, Garrett. So let's get to some of the numbers as they're coming out today and how things look over this week here in Arizona.
All right, let's do this. Take you to the AZDHS dashboard. That's where we like to always start off these things. And I do apologize. I'm obviously, I've got my bow tie on, and I'm in a different sort of situation here. The camera's completely in a different place, so I'm going to try to look at it sometime. But where we are just under 1,900, under 2,000 cases today. This is the second day in a row that we are at this mark. 22 deaths reported. You can see this is off of 15,687 tests. I don't know the rates right in front of me right now. I will try to run them. I'm having some technical difficulties getting to my COVID stuff from the studio, so I'm a little handicapped, more than I typically am. But let's really look at this by week. We really need to break this down by week because we only do this once a week now. So let's take a look at where we are. If we look at the AZDHS's website, and we can see where we were on October 25th. This is the most complete week, so this is what we really want to focus on. And we can see 10,000 cases added to that week. When we go back into the curve, we see that this is sort of putting us back into the late July, early August timeframe, and most of our data does suggest that we are at that location. You can see that we are not moving up at the same rate we did in the first curve. However, the trajectory has increased, and it's increased to about 40% now. So we are seeing basically a case rise at this point, and we are going to have to keep looking at this to see what's going to continue on. I know we have a lot of information. We're going to look at the schools today and see where things are. The RT, things are definitely on the increase. That's where we are right now.
Yeah, and not to merge the two worlds, as I've been talking about dealing with elections and now dealing with COVID, but we do want to update you on a concerning situation that we're hearing about in the newsroom. And we do have reporter Sonu Wasu on this. She'll have this story at 5. Here's what I know about this so far. We have 6 poll workers who are sick, and 5 have already gotten their test results back. They were confirmed with COVID. Now, these poll workers were wearing face shields, and they say that people who voted in this particular location that I'm about to tell you about do not need to go get tested, surprisingly. Authorities are saying that they just weren't in there for long enough, and that their risk of exposure, even though these 6 poll workers are sick, is still low. But I want to let you know, if you went and voted at the Peoria location, if you voted in person there at 91st Avenue in Peoria, that's the area in concern. So what they did is they went in and sort of fogged the place and tried to make it a little safer for the next round of voters who came in. That was over the weekend. They did reopen with a new set of poll workers out there. But once again, this is at Peoria, 91st Avenue in Peoria, where we had 6 poll workers sick and 5 have now tested positive for coronavirus. So wanted to keep you updated on that. We'll have even more. Sonu's working on that story. We'll have even more on that coming up for you at 5 o'clock tonight. So Garrett, one of the other things I noticed in all this was the CLI percentage has already gone up to 4% now across the counties here in Arizona, 4.4%, I believe. So we're getting closer to that moderate range instead of the minimal exposure range that we saw.
You can see that we have had a trajectory increase on our COVID-like illness exposure in these these lines. They are updated every Sunday. Now we do have a decrease from the last 2 weeks. It's been a moderate decrease. It went from 4.6 was the highest on October 11th, and this is the inpatient number, to about 4.4. So we are seeing a slight decrease in the inpatient CLI, and we do see also a decrease right now on the emergency. Now, this is, of course, a statewide number, and what you're talking about is the Maricopa County numbers. So we will get to that and show you what's the difference there. And yeah, we did see definitely an average of a full point increase in Maricopa County.
And that's important because everybody's watching these schools, and we'll get to that school information shortly. But those categories, there's 3 categories that they watch for schools. A lot of people had schools dip into the red category. In one of those, the third one in that list is the CLI. So the CLI going above 5% puts you in moderate, above 10%
Yes.
is going to put you back into that substantial category. So while people could argue about the merits of that particular metric being used to judge this, it is still one of the things that's used and one of the things worth tracking. So we'll keep everybody updated on that. What else are you tracking here, Garrett?
Well, let's take a look at the hospitalizations and see where everything has been. We do see, again, we're going to start with the ICU numbers. We can see there has been a fairly significant increase from about late October 30th to October 31st. We can see that it sort of started to begin a larger than typical increase. However, we are still under with our ICU where we were even at the beginning of this for COVID-19. So you can see these numbers, 18, 19, 20%. Here in this one, we're down to about 15%. We are increasing. It does have 2 days of leveling off. That's not enough for a trend at this point, but we will watch this to see what's going on here. Let's also look at the inpatient numbers. You can also see increases with the inpatient numbers. The census, this is now just to explain this is the available beds. This is the non-COVID beds, and these are the COVID beds. And you can see a gradual increase in the number of beds that are being used across Arizona, but it is quite gradual.
So Garrett, when you're looking at that, when you highlight the red, does that mean we have more than 1,000 people in hospitals in Arizona
Yes,
with
we
COVID
have more
right
than
now?
1,000, and this is the inpatient. So you have to combine the two because they do combine the ICU and the inpatient. They are not they are mutual exclusive. So it's actually closer to about 1,200, 1,300.
Mm-hmm. Okay.
Now let's go to the emergency room department. This one tends to not move as much. We do see we have had an increase from it looks like November 1st all the way to November 5th, going to 47%. We don't really want to see this one increase. This is a leading indicator. We'd like to kind of see it. You see it does have a gradual increase, but it hasn't been that astounding. And we don't want to see this one increase at any sort of high rates, only because that would indicate that we're going to start seeing even more pressure on the hospitalization systems.
Yeah, that's one of the things we continue to track as we watch all of this. Let's see, Garrett, on this page, actually on Maricopa's side, I was noticing a bit of a change in how many people were ending up in the hospital there. I'm curious your thoughts on that because it's saying it's down to 8% of the cases in Maricopa County then showing up at the hospital. We've seen that in recent weeks as high as 11%.
Mm-hmm.
So is that something, because we're kind of going into this next surge, that we're not seeing that number as high just yet?
Yeah, it would be. We've had an increased number of cases, and these cases, of course, are being driven by people who are under the age of 45. Mm-hmm. And we do know that risk factors, this is not technically, or not a super high risk group for COVID-19. So oftentimes, if you see significant increases in that age group, it will not be reflected in the hospital or hospitalizations. And there's also a concern, of course, that as we get into a surge situation with the number of COVID cases, that their ability to track hospitalizations starts to decrease. We saw that during the first surge. We've had a really good handle on hospitalizations for the last several weeks now, for 2 months now. But if for some reason it starts to get into a situation where hospitalizations are not being reported at the same level because hospitals are starting to feel a little overwhelmed and they're not reporting at the same, because their priority is on working with the patient. So
care.
Patient care. So they may stop reporting at the same levels, and then there'll be a lag in reporting. These will be reported eventually, but it could start to create a situation which the hospitalizations will lag. So let's look at the, you said we wanted to look at the hospitalizations. So let's go to overall cases here, and we can see what you're talking about. We can see that in hospitalizations, it's now at 8% of the hospitalizations. That has a lot to do with the growth here in these two metrics, especially the 0 to 19 that has grown a little bit in Maricopa County. It was 13% a couple days ago. Now it's 14%.
Yeah. So I'm curious in the comments for people, and I don't know if we've talked about this before. Is this something that, when a lot of people are getting more lax about getting COVID, and you're seeing anywhere from 8 to 11% ending up hospitalized? I'm curious for those of you who are watching right now, are you saving up for something like this? Are you putting extra money aside in a family budget just in case somebody gets sick? Because 1 in 10 are ending up with a hospital bill after all of this. I'm curious if anybody's thinking that far ahead, or thinking I'm going to try to cover the bills when I get there, or figure that out. Let me know in the comments. We always get some really good conversations started there. Sarah was asking a few minutes ago if either of us have slept this week. We really have not. I mean, I won't show a brand here, but there's a giant coffee going on next to me here. So Sarah, thank you for the thank you. We still wanted to make sure that we joined all of you on here today and got you updated on the numbers. But yeah, we are all very, very tired, and we'll be working all weekend to keep you guys updated. And we'll likely be back here next Friday with you to keep you updated on this as well. So if we're mixing up some of the numbers or stumbling a little bit, that's why we're on a little bit of sleep. Melissa just asked a few seconds ago about the dates that things are plugged in. I think, Melissa, you're asking about the dates. Okay, she's asking, what are the dates of the test results you are showing? Are they from last week or last month? So the date that you test always gets plugged back into that chart, which is, Garrett, why you always warn the last couple days might not be filled in entirely. So when we bring those results to you each night on our newscast and say that, 2,000 people have tested positive, it's the new numbers that have just come in, but they could be from the last couple of days when that collection sample was taken. So they're logged based on that. Is that a fair statement, Garrett?
Yes, that is a good characterization. And you can see this actually, Maricopa County does a great job of showing how this works, a little better than the AZDHS, because they use they do the shading for you, so you don't have to guess it. So there was a time months ago, we're talking back in July, when if you looked at this curve, the shaded gray area would have gone back about 8 to 10 days, because there was about an 8 to 10 day lag on when they were getting their positive case results back. Now you can see that there's confidence from Maricopa County Health that it's only a 2-day lag. They're saying, okay, when you look at this curve, which is the case curve, ignore the November 4th and November 5th numbers, because we are not confident that those numbers are filled in. But once you get to November 3rd, we're very confident that it's not going to change that much. It's still going to change, of course, but it's not going to increase by, say, a factor of 3.
Right.
It just may increase by 10%. But when you're talking about 1,000 cases, 10%, that's not as much as, say, 300%, which is what these are. So, and you can see they actually do this for all of them. They say this is what our lag is. So you can see the hospitalizations. They say trust our data back to October 27th for hospitalizations, but everything after that, we're not sure that it's filled in properly. It does the same thing with deaths. You can see, well, deaths, yeah, you can see the way they do deaths is they do it with the average and not the shaded in area, because deaths are very different the way that they're reported. They can be reported over a 5-6 week period. So instead of giving a shaded area, they give you they say, okay, we're going to stop the average this far back, which is, it looks like October 20th, just to make sure. So they give a 15-day window to make sure that at that time they're getting at least an adequate death report in order to be at least as accurate as possible when they do the average.
Yeah, and Kimberly's asking, to that point, how much lag is there in the death count? So I know you have some really great charts that help us better understand where the dates of death are plugged in once the research is done to actually say, yes, this was a COVID-related death. Yes. Do you have that here in the newsroom? Or is that something
I wish I did. I'm having some technical difficulties reaching my computer at home, which has that. I haven't reconfigured my software to run on the software here, so it's all pointing to my computer. So I try to remote in, and
no worries,
it's happening. So I do apologize for that. I don't know why it's not working, but I was planning on showing that, and I've got nothing. So I do apologize. But I will. What I can say is, oftentimes nowadays, what we see is a death report from the last week or so will have about 50% of the deaths that are reported any given day have come from the last 7 to 10 days. And then
Okay.
we'll have about 50% of the deaths being reported from about 5 to 6 to 7 weeks after that, prior to that. And that's typically how it has been. It has been sort of this split where they've got a really good idea because they're likely, there's hospitalization deaths or any of these things, and they have a better idea of what's happening for those first few days, and then and that's likely people who died, of complications of COVID at the hospital. And then you have people that were like, unfortunately, the people that were in ICU for a long period of time,
Yeah.
and they pass away over time after being diagnosed with COVID, and that's why some of those it takes a while for those to get through the system.
Yeah, to get plugged in. Kimberly writes, "You're forgiven. You've been a little busy." That's what I love about all of you joining us so many times on here is that
Thank you, Kimberly.
you get to know us really well. So Meg is asking, the death count is what with these high numbers? So Meg, the death count at this point in Arizona is 6,109 people. So up 22 people, 22 Arizonans that we lost in the last. Let's see, as Garrett was just attesting to, it can be any amount of time going back, but just reported into us 22 overnight. 1.2 million people have died from this thing globally, 235,000. 235,000 here in the US. So our case count number is similar to the loss of life number across the US. So just think of how many people that you know who have been sick with this. I have several family members fighting this right now, and it really puts it in perspective. Every one of those fighting it would represent the loss of life if you expanded that across the US. So
I do have the we've been here before. This is the DVOC 91.
yes.
This is at 91dvoc.com. I'm sorry. Really to show a comparison is what is and this is all reported. This is an actual date, but this is why we see this. When you looked at that Arizona, the Maricopa County line, and there wasn't this sharp increase. Well, that's because a lot of those deaths were added over a period of 2-3 months. Here we have what this reported number is. You can see that it had been going down. There was a time about 10 days ago when we even though we were having increased cases, we had one of the lowest death report averages in the country. And now, ever since then, about 6 to 7 days ago, that number has been increasing pretty substantially. We are about in the 18. I think when I checked it this morning, we were at about 15 to 16 average deaths a day reported at this point. At one point, we were in the single digits there.
Yeah. Okay. So let's get to some of the other stuff. One of the things, Garrett, that is helpful for people to understand is how many active cases we have in Arizona at one point. I don't know that you've been running those numbers specifically this week, but the last range that we had was somewhere between 20 to 30,000 active cases here in Arizona.
I that's unfortunately again part of my software that I can't run, but I would just based on what I've been looking at, and obviously with all these newly reported cases, that number is going to be closer to 35,000
really?
At this point, because when you're adding 2,000 cases to the system, those are all brand new cases for the most part that are being added. So that pops that number up pretty substantially. So we're going to be closer to 35, 40,000 at this point.
Man, it feels like not too long ago we were able to get it down to 18,000, and we're already back up to that. So, okay, we'll touch on active cases even more next week when everybody's back at home. The projection sites.
Yes, that I can do. That
we can do. I feel like
we can do projection sites without my stuff. So
I'm afraid we're gonna update projection sites with percentages because we've been dealing with percentage of votes so often this week that our brains are going to be there. But we do want to teach all of you who haven't been on here with us how to find these projections. What are some of the challenges of some of these sites where the numbers are stable and where the numbers you could look at, but use just a little bit of caution when judging them and making decisions for your own life. So this particular site is one that's been helpful. And we want to remind you, we're going to go through Arizona numbers, but all of you that are watching or who are making the choice, the educated choice to, for the holidays, for Thanksgiving. We want you to know the information for other states as well. So just do that pull down bar if you are going to be traveling, so you can learn a little bit more about those places. How do things look though for Arizona? What are the projections
since
there?
last we met on Friday, there has not been a lot of change here, which means that these projections are doing a pretty good job about tracking what's going on when they're not when you don't see a lot of adjustment to a forecast that's 3-4 months out. That's actually, as far as the projection, that's a good thing. So you can see this one. It does believe that our current projection of total deaths by January 31st is going to be about 9,000. 1,113 is what it has as its median value. When we go down to the daily deaths, this one does believe that we're going to continue to increase. And I think we've seen this before. Again, this hasn't changed. It believes we are going to continue seeing increases until about late November, early December, and then it's going to begin to level off. And then when we look at daily infections, I'm going to take out some of these variables and just go right to the projections line. It does believe that we are in the middle of a second peak, and that second peak should begin to level off on looks like about the middle of this month. So we'll see by the next time, in about 2 weeks, when we are meeting to do this COVID-19 by the numbers, we should see if we are experiencing a leveling off at this point.
Okay, but leveling off at that high point, that's the concern, is that
yes, of
we're going
course,
to continue to see this. Okay, what else is on here before we move on to the next?
This is the hospitalizations, and we've talked about this before. So far, all of these hospitalizations are presuming that, for the most part, we are not going to, they say that there is a chance that we will exceed our entire ICU capacity in the state of Arizona, not with COVID-19 patients, by the way, but just with all ICU capacity. And it does think that could occur on November 22nd. But again, you can see how wide this line is. When you see really large estimates like that, that means that they have a very high degree of uncertainty as to if we are going to exceed that number or not. So we just have to keep watching this to see if this ICU number does keep increasing. But as of right now, it does appear that there's not a lot of certainty surrounding our ICU capacity and if it's going to be an issue. You can see with all beds, it does not believe we are going to hit any sort of inpatient issue here, but it does think that we could get close in early December. And then ventilators, that has not been an issue, and I don't perceive it's going to be. You can see they don't even have a limit line on here now, because almost every state, at least my understanding is, the states have plenty of ventilators at this point. So we should not be in an issue for that at all.
Okay, yeah. One of the concerns, though, if our hospital metrics would be overwhelmed, that's the week of Thanksgiving.
Yes. Yeah.
Really.
Yeah, and it's sad. It's the ICU too. I mean, it's
yeah.
It's
sad. It's really sad timing. So please be safe out there. Okay. One of the other things we want to update, in the past few weeks, we've been talking about how the numbers are increasing overseas. So we're seeing higher numbers, record number of cases in places like France and Germany and the UK. I want to let you know that Illinois saw their biggest single day increase ever of COVID cases. So they had 10,000 cases reported in Illinois just yesterday. It's something that you're obviously going to want to watch. And then comparatively across the country, to sort of put this in perspective, we did have the biggest one day ever yesterday. So things are going to be reported in one day later. We'll be watching for it later this afternoon. But 116,000 new cases here in the U.S. reported in overnight, 53,000 people in the hospital, 10,000 Americans in the ICU, and just yesterday, 1,124 Americans lost their lives to COVID. So these numbers are very, very high right now. One of the places, since we're not here with you all the time, for you to be able to track this number yourself, go to covidtracking.com. That's one of the sites that you're able to see each state. You can see this information as it comes in, be updated not only on Arizona, but places where your loved ones are that you want to keep an eye for them. That's the place to go. And then you can see the numbers in the U.S. as well. So, Garrett, I don't know if you happen to have that pulled up right now, but covidtracking.com.
COVID tracking? Yes, I'll go to COVID tracking.
It's got some really simple graphics that are really easy for people to read. They don't need to be an epidemiologist to sort of pull information off this page. And then there's pull down bars.
Let me get to that chat. Sorry, let me get to that.
That's okay. That's okay. For each of the It's got it for each of the states. It's also got it for the US. You can see the change over the full range of the pandemic or just the last 90 days.
Okay, here we go. I got it.
Make the best decision for your life. But new tests, current hospitalizations, new cases, and then sadly that last column of deaths right there. So if you're watching from home, you want to be updated on that particular number. This is the place to find it. I just find that this site's easy to read. Garrett.
It is. It's a very good site. And I said, if you want to do any sort of analysis on this data yourself, this is a great site to go to. All of the data for all of the states, as well as many national data or international data sources, can be found here. So you can really sort of dive into the data here and see what's going on. And it's actually, because I've been doing election coverage for the past week, I actually had to use COVID Tracking Project a lot this week to fill in some of the data gaps that I have now because I missed reporting for about 2 or 3 days. So I spent a lot of time on this site for for the last couple days to catch up. So it's an invaluable tool. It really is, because had I not been able, had this tool not existed, that data that I missed would be gone forever because the way things work. So this is a great tool for everybody.
Kristen writes in, thanks for the numbers update. Amazing that you can shift from election data to COVID data and still give us so much great info. Kristen, thanks for the compliment. Like I said, we're a little bit more stumbly and tired today, but we hope we'll be back to 100% by next Friday. Hopefully we'll get some rest, although we will be working straight through all weekend. I've seen some people post in the comments that they did go vote at that 91st Avenue in Peoria site where so many poll workers are sick. And I just want to remind you that people are saying you don't need to necessarily go get tested if this doesn't sit right with you or you start to have symptoms and you just want to go for peace of mind. There are so many places to go get tested right now for free. I want to add that in. If you haven't gotten tested, it's so easy, especially at some of the saliva testing sites that ASU has set up. If you go to the AZDHS site on the main page there, they're going to give you a list of places that are doing different tests, and then it's a pull down menu, and you can choose the date or the location that you want to go to get tested. And they make it so easy. They've added saliva tests all over the state as well. Did somebody write they didn't take you for a bow tie guy? Stephen writes. It works, he says, though. It works. You got a thumbs up. They like the bow tie. Amber writes, it's adorable. Good deal. Garrett, you clean up pretty nice, they're saying. Dig in the bow tie. Yeah. Margaret writes, he's bringing the bow ties back. So it's everybody loves it. All right. Some of the other things we want to get to, and we talked about those hospitalization numbers, but I want to touch on this. The flu report is out, and I've seen, we always see flu comments, and I just want to let you know the latest report just came out here in Arizona. They've added 8 people to the list. So we have 40 total cases of the flu. And just for perspective, last year at this time, when people weren't masked, they weren't social distancing, and obviously a different strain of the flu, so it's not exactly apples to apples, but 300 people had the flu in Arizona at this time. And remember those.
And of course, just to always caveat, these are flu cases that are serious enough to merit attention and are being recorded because they're clinical flu cases.
Yes.
Multiple, hundreds of thousands of people get the flu
and don't report it.
They don't report it, but they don't get, these are clinical cases. So these are serious cases of the flu. So it is an apples to oranges comparison because people are getting tested for COVID-19 that do not have serious symptoms. So just to make sure everyone understands that.
Yes, absolutely. It is not the same thing at all. And so some of the times, some of the things people would rather look at, sadly, but to understand this better, are the number of deaths reported in. That is released publicly. I want to let you know that is also on the AZDHS site. You can see the numbers of deaths from flu cases, from pneumonia. It is all listed there, and you can see that these numbers are nowhere near what we're tracking. If you lump flu and pneumonia together in Arizona, you get about 600. We're tracking over 6,000 deaths in Arizona just in the life of this pandemic. So before that's the place to go track that information if you're really interested in comparing that, because every single time we talk about this, we see that come up. So, okay, let's talk about some of these schools. Schools are shutting down left and right. In fact, we're going to try to get our list updated here in the newsroom as well, so we can get the very latest info coming into you. But if you want to check that list, it's abc15.com/schools. We've got a list and we're keeping it updated. I mean, it's I can't even list all of them because the emails are coming in pretty rapidly about schools making different choices here. So without further ado, that brings us to what everybody wants to see. And yesterday's map came out, and we want to spend a little time on it. As I remind everybody, there's several things to check when you go to this map. You want to check your zip code, you want to check your city, you want to check both school districts. So if you don't live in an area that has a unified school district, you'll want to check it for the high schools and for the elementary school group, if you will, because you're going to see different numbers in each one. So to make the best choices for yourself and for your family, go to each level. So Garrett, with that, I was shocked yesterday when I pulled this up, and boy, yes, you're seeing it there, a lot more red.
Yes, there is a substantial red. You can see almost all of the Southwest. This is where one of the initial, when we were having our first outbreak, this was sort of one of the core areas that the outbreak was occurring, and you can see that it's sort of come back. These areas have all seen this last couple of weeks of very high number of cases per 100 per school district. We're looking at elementary school districts at this point, and you can see triple-digit case per 100s. Fairly high percent positivities, although most of the high percent positivities are still in the yellow. You can see the COVID-like illness report for Maricopa County. We were talking about this is now at 4%, so this is increased, obviously. When we go to high school districts, this is a slightly larger area. But you can see the percent positivity still 11%, 163% for a place like Tucson. For Agua Fria, it's considered substantial right now, 152%, or excuse me, 152 case per 100. That is an increase from the week before. And then when we look at the unified school districts, something completely opposite happens. We can see that the east side of the district of the county is where we have substantial growth. We have Queen Creek, where we have 158% case per 100 with a very low percent positivity, which is very interesting that occurred. That usually means that they were able to contact trace or figure out, and a whole bunch of people were gathered in one place, and a bunch of those people got COVID-19. Because you can see this one it looks more like an outbreak, where it's 10.3% with 150, whereas this one is like, oh, we only have we have this low. We basically found a bunch of tests or a bunch of cases with a low number of tests. So here we go with case per 100, 144 with 6.5% positivity. That's another one. And then we have 152 in Gilbert with an 8% positivity as well. So again, really high numbers in the East Valley Unified School Districts at this point.
Yeah, and to remind many of you who are asking, many school districts have set up a dashboard for you. So yes, you'll want to check that to see the very latest numbers. I was just checking one in Chandler, one particular high school, I believe it was Castile High School, had 16 cases. Many of the others had one or two, but it's definitely worth checking out. So go to your school district's particular website to also track that, as well as all of this right here.
You could see like Mesa School District, for example, you can see it's still not considered substantial because the prior week, they still had an under 100 per 100,000 case per 100. So it's at 95%, but it did increase this week. So it's likely going to revert to red next week. Chandler is probably in the same situation. Yeah, it looks like it almost doubled, but it's from this week, and it takes 2 weeks for it to get to substantial.
Into the red, yeah. So
red,
you're saying the case per 100 is what you're seeing double?
Yes, the case per 100 seems to be doubling in most of these situations.
That's what I was noticing. I did, in all the crazy running yesterday, I did take some time to go through this yesterday afternoon, and I clicked on several of these, and that's what I was seeing is the case count was just so extremely high. Many places were looking like it doubled.
Yes, and we'll look at that when we get to the zip codes, because that's really where we're going to see a lot of the doubling is through the zip codes.
Yeah.
And because it's such a small area. So let's just take a quick look at the cities. This would be reflected in most of the maps we've already seen. So we can see, like, for example, Paradise Valley still has a fairly high case per 100. But these are we've seen this Goodyear, very high case per 100 in Goodyear. And then this small Tolleson right here, extremely high case per 100, 311 in such a small area. It's pretty incredible. It looks like it's doubled over the last week.
Mm.
And then most of the other, we do actually, Wickenburg that's interesting. It looks like it's a percent positivity that's causing Wickenburg to be in the red. It looks like it got a 15 or 16%, and it's a very small rural community, obviously. And then here's the zip codes. So this is
A lot of
yep,
change in the color there.
yep, a lot of change in color here. This is incredibly different from what we're used to seeing. And what we have here is let's go through some of the ones that we're seeing a lot more action on the east. We talked about this several weeks ago, how we were seeing sort of indicators that stuff was happening on the east side of the valley, when in the first round there wasn't much going on the east side. And here we have basically the same case per 100 with a slightly higher positivity in this one in Mesa. A lot of all of these are going to have basically the same look to them, triple digits here. This one 85225. This is the Salt River Indian tribal reservation. They've been hit really hard in the past, and it looks like it continues, which is very disappointing. It's hard to see such a small rural area get hit so hard.
Mm-hmm.
Yeah, and so you can see a lot of these right here. There's a lot of red going on, and it's not just the universities. Before we were, when we were talking about these, we would be talking about the universities and about how this stuff is resonating from the universities, and that's just not the case anymore.
Yeah, a lot of people are asking, does this have anything to do with people coming from other states and winter visitors showing up just yet? We tend to see lots of winter visitors after the holidays, so they stay and celebrate with family, and the real busy season for Arizona begins literally the day after Christmas, that's when they decide, I've been around the grandkids or the great-grandkids, and now I'm heading down to Arizona, and we see that January, February, March really get busy for winter visitors.
Yes, and the hard thing about that, of course, is we don't actually know if it is because of winter visitors. That is something that can only be done with contact tracing to be able to tell us, what sort of is causing these sort of not pandemic, but causing this sort of increase. And what we can tell is what like AZDHS, I believe they said something yesterday as to the fact that they are seeing a significant rise in that 18 to 40 demographic again. So at first, when schools were opening, we were seeing a rise in that under 20 demographic, and what seems to be increasing. It's going back to that 40, that under 45, under 35 demographic that's starting to increase as well.
Yeah. All right. We can go through these maybe for a few more minutes, but we do have to get to some of the other items of the day. I'm seeing some people put zip codes in, so we can jump into that for just a minute to get them.
85033 looks like it had a significant increase. There is it looks like 85201 is in the red right now. It was not in the red a couple weeks ago, which is why it's in yellow, but it is in the red at the moment. I think we're going to see a lot. That's going to be a pattern. We're going to see 85204, which was right next to it. You can see 2 weeks in the red, very high percent positivity from last week, and it resulted in a few more cases this week to increase the case per 100. 85345. We can see it's actually a decrease. This is one of the zip codes that we're seeing a decrease in. It's from 80 to 72 with a lower percent positivity. So that's good for them, especially with what's going on out there. 85257. We can see this one is in the triple digits. It looks like it's almost doubled from 67 to 110. And then let's see, 85051. 85051 looks like it's also a decrease. Vicky, your zip code has decreased, has lower percent positivity as well as a lower case per 100. And let's see, next one to 85206. Sorry, I should actually put in the zip code right. I'm told that actually helps when you're trying to do this. This has been an increase. You can see 93 to 162 with a higher percent positivity rate. Let's see, 85295. 85295. This triple digits looks like it's not doubled, but it has increased from 5 to 6% positivity rate for that one. 85018. 85018 is in the double. Looks like it's another one of the almost doubling zip codes.
Wow.
So it's near, I guess, the Mummy Mountain area in Paradise Valley.
Yes,
Increase of
it's
what would
actually
be COVID-19 positivities. Let's see, 85331. 85331 at the very top of Maricopa County. Lower numbers here, 45 case per 100 with a 36, which is the case per 100 right now. So 85306, is that right? Yes, 85306 in Deer Valley. And this one actually has it's about half, so 77 to 48. So it is actually decreasing there. Let's see, 85283. 85283, a slight increase from 69 to 80, but the percent positivity rate is actually still just in the almost in the green. So let's see, 85138. Nothing there. I'm so sorry. 85283. I don't have anything for that one either. I'm sorry.
Yeah, I should remind
Then we have
everybody, we're
Maricopa
only
County.
getting these from inside Maricopa County. So anywhere else outside, we're just lucky enough that Maricopa County provides these numbers and we're able to dive into these zip codes. So we're not avoiding anybody else. Sorry, we just don't get the same kind of metrics from some of the other places.
Yeah, this one looks like it's about tripled from the week before, but there's still fairly low case per 100s. 85029. 85029. This is 62 to 72, so slight increases in this zip code. Let's go to 85016. 85016, this looks like it is about the same it was, so it's had a slight positivity rate increase, but the case per 100 is about what it was last week. See 85209. 85209, this looks like it's about the same, so that the case per 100 hasn't really changed from week to week in this district. It's sort of level at this point, or in this zip code, sorry. 85204. This one has increased slightly from 113 to 142. You can see a very high positivity rate in last week's numbers at 10% and a slightly lower one of 8% this week. 5301. 85301. This one's in Glendale, and it does have a very high positivity rate this week of 14% with a case per 100 of 150. So whatever happened in Glendale or in this zip code happened just this week. 017. 85017. This is fairly high. This is 12% to 11%, slightly lower, I guess, by 1 point. And a slightly higher case per 100. So I would really say, Yolanda, that zip code is more level than anything else. But level, in the
level
red.
at a high point.
Yes, this one, slight decrease. I think I've already seen this one, but the slight decrease in 85345.
All right, we're going to have to.
Yeah, one more. I'll do one more and then we're done.
more.
85022 wins. That's a slight increase from 53 to 74 in that. But of course, you can always go here and check these out yourself. They are available on the web.
Yep, and it's something you'll want to check on Thursday. That's when it's updated. It's been earlier in the day on Thursday. I am happy to report now. So we'll check that with you next Thursday. We'll get you updated on that information, as we always do. One of the things to watch really briefly, Garrett, I know that on Maricopa County's site, they list the care facility breakdowns and the school breakdowns, so you can look at the number of cases that you're seeing across Maricopa County. It's one of the more helpful spots, and I want to teach people where to find that too. It's just on the health department site there in Maricopa County, and then you'll want to go to that top bar up there. Oh, thank you, Garrett. So awesome. And either click schools or click care facilities up there at the top, and you'll see a little bit more of the breakdown of schools and a little bit more of the breakdown of care facilities. I know that's of interest. I saw some of the names coming up, and we've been doing this so long that I get to know each of your stories and situations, and I know that's also important to many of you on here. So this is another spot to check. It's only Maricopa County, but that's where you can find it. Both schools.
Yeah, this is what they'll tell us what's going on. It says 44 of the schools are open, 9 of the schools are closed that have what they consider as defined as an outbreak. 174 students and 61 staff in total.
So helpful spot to check as well. Garrett, I know minutes from now, we're going to dive right back into our election numbers and try to track this a little bit day by day for everybody, and then have a full update for you coming up next Friday. But what sort of things are you going to be watching throughout this weekend and throughout this week?
I think once I get back to tracking, which I'll begin here soon, we are going to
No rest, Garrett.
we're going to be looking for, of course, the CLI. I think at this point, the CLI has probably become more important than anything because we want to see where this is going. And if it is going to continue to increase as far as the hospitalization, because it's already clear that we are in a surge.
Yeah.
We don't know how high the surge is going to be or when it's going to level off, but it's very clear we're already in a second surge. So with that's being the case, it becomes much more important in many ways to actually watch the hospitalization numbers and see how much pressure that COVID-19 is putting onto the system at this point.
Yeah, I mean, thank goodness for our healthcare workers. I know that we're talking about our long hours, but they're about to go into this season of
Absolutely.
very long hours, and they have not had enough of a break between these two waves. So, Carrie writes, "Thanks for doing this today. I wasn't sure if you'd be on after the week you had. Isn't that the truth, Carrie? But we felt it was important to keep everybody updated, especially where these numbers are in Arizona. For any of you joining us late, we hit more than 2,000 cases yesterday. Very close to 2,000 cases today. Other big milestones that we hit this week, we passed 250,000 cases here in Arizona. We passed 6,000 deaths here in Arizona. So it felt very important to us to keep you all updated on this. So we appreciate your kind words. I want to remind you where to find us, where to catch up with us. Garrett, your Twitter page, my gosh.
It's a little on fire right now. It's a bit of a hurricane.
It's a little on fire. We posted a joint tweet, if you will, yesterday after some of our conversations, and I believe it got like between 2,000 and 3,000 likes.
Yeah.
I was just going, my gosh. Okay, so people around the country and around the world are watching your Twitter account right now, not just for COVID updates, but especially for the election information as it comes out in Arizona. So just be warned, it's very busy over there on that page. You can find Garrett's Twitter account and all those new followers over there at Garrett_Archer. My Twitter account is at Katie Ramel. Many of you are watching us on Facebook. If that's your preferred method, you can find me at facebook.com/news from Katie. We're going to try to get some sleep in all this. We got really big updates coming tonight, even more numbers coming in from across Arizona. And we also want to thank all of you that are watching this on your favorite streaming device. Hopefully that's been an easy place to catch this as well for you. So Vicki writes, thank you both for your continued coverage. Vicki, you're so welcome. Thanks to all of you who are joining us on here. We appreciate each and every one of you. And we hope that we help provide you with some more information about making the best choices for yourself and your family based on the data that's coming right out of Arizona. Be safe, everybody.